Hello, welcome. Thank you for joining me today. I'm going to start sharing my slides in just a second. Hopefully this will work. Yeah. Here we go. And then I will introduce myself a bit more. Okay, fantastic. Hello. I'm going to be talking to you today about global vaccine equity or inequity, really, and some tips and tricks for campaigning during a pandemic, some of the things that we've learned over the last 2 years of fighting to free the vaccine and for equitable access to tests, treatments, and vaccines for COVID-19. So this is me. My name is Merith Basey. I'm the Executive Director for Universities Allied for Essential Medicines in North America. I'm the co-founder of the Free the Vaccine for COVID-19 campaign in partnership with our allies at the Centre for Autistic Activism. I use she, her pronouns, and I'm originally from Wales, from the UK. If you'd like to find me on social media, you can at Global Diabetes, spelled as you see on the screen. And today I'm going to talk to you, as I mentioned, about what's going on in terms of access to the vaccine, what vaccine apartheid is, and what it's been like to organize in a pandemic, and some things that I hope you'll be able to take forward for your own campaigns. So here is a grim look at where we are in terms of the number of people who have died from COVID-19. It's unreal. Globally, over 6 million recorded deaths. We know that probably this number is much, much higher when you start to look at excess deaths because of the people who've passed away, because they haven't gone to the hospital, because of COVID for other treatments, or because there simply weren't enough beds. Also in areas where it's harder to record numbers. So we should take a moment to really remember those folks that we've lost and acknowledge how the pandemic has really affected everyone's health and lives, although that burden has not been equally distributed, and neither have the long-term consequences. Shockingly, 1 in 5 deaths have been here in the United States, despite being only 4% of the global population. So that means that people in the US at the beginning of the pandemic, at the beginning of the rollout of the vaccines just over a year ago, were 20 times more likely to die from COVID-19 than pretty much anywhere else in the world, despite healthcare being the most expensive in the world. So something is not right. And I know that people who are listening to this know that already, but it is just a reminder that we need to change the system, that we do need universal healthcare for everyone, everywhere. And that is part of the solution to this crisis and future crises. So where we are in vaccines, this is as of March 17th, we've had over 10 billion doses administered. So the question here is, what percentage of those were administered in low-income countries? And right now, that's looking at about just 10%. And that's 2 doses, not including a booster. If you include a booster, it's close to 0, which is shocking. And this, of course, is another way of looking at that data. And you see, of course, the continent in Africa looking abysmal in terms of access and to the vaccine, in terms of who has received it. And this is what we have called and have been calling in the movement for a long time, vaccine apartheid. And this was predicted. It was actually why we launched the Free the Vaccine campaign in March 2020, before vaccines or treatments were even available. And vaccine apartheid is happening while pharmaceutical corporations, of course, are profiting from this reality that they have chosen to pursue. There is no question about that. At the same time, we know Pfizer's revenue could hit over 100 billion in 2022, which is unheard of even in pharmaceutical standards. It's shocking. And the oral COVID drug Paxlovid could contribute, I think, about a quarter of that total figure. And we know that rich nations like the US, like the UK, are not sharing. They're not sharing the tech. They're still hoarding. The same thing is playing out with the treatments, like I mentioned, Paxlovid. The same thing that we saw with vaccines, we're seeing with these new pills that have hit the market or are hitting the market. And just, you know, the title of this article that was in Stat News really does express it all. We certainly do have enough COVID vaccines for most of the world, but rich countries continue to stockpile the boosters before healthcare workers in some parts of the world still have yet to receive a full dose or doses of the vaccine. And we know that patents and the intellectual property linked to these vaccines is obviously part of the problem, and is certainly a bad match in a pandemic. So we have been tackling at UAM and Center for Artistic Activism this campaign to achieve key goals in testing, treatment, and access to vaccines, so that they would be sustainably priced, which means that governments wouldn't be price gouged. You know, you may say, oh, it's not a problem, it's what pharmaceutical corporations charge the government, but obviously the higher the price that is charged for the US or the UK, the less money there's going to be in our taxes to go to other areas of health. Also, it means that that high price is going to impact the price that other countries or nations are going to be able to afford or not afford around the world. So pushing for equitable access to test, treatments, and vaccines, and ensuring that they're sustainably priced is really key. Available to all, so that should include, it shouldn't include what your zip code is, it shouldn't matter your immigration status, what insurance you have. It should be available for everyone, and they should be free at the point of delivery. And we have seen that happen, you know, in high-income countries in particular, but around the world. But the key piece has been the high price of these vaccines that are being charged, when we know that this was all of these products were publicly funded. Billions of dollars have gone into their funding. Even prior to the pandemic, 700 million was spent, I think, since 2003 up until the beginning of 2020, just in the US alone on coronaviruses. And you can actually take a look at figures for how much has gone into research at publicmedsforcovid.org, which is a tool that UAM developed and has been recognized by the WHO during the course of the pandemic. So in March 2020, we jumped into action at this particular moment, because we knew that, given the history of the Access to Medicines movement, we unfortunately had a good idea where things would be headed. But we knew that it didn't have to be this way. And this would be an opportunity for the world potentially to come together in solidarity to get through the pandemic, by making sure that diagnostics, treatments, and vaccines, once they became available, would be for everyone, everywhere. But quickly, this was in June, we saw already that the agreements were going to protect nation states first rather than be shared equitably around the world. But we decided to keep the story of Jonas Salk, Dr. Jonas Salk, who discovered the polio vaccine in our minds as we worked and organized. I'm going to play this short video for you to be inspired and to keep this in mind as we continue our fight.
Who owns the patent on this vaccine?
Well, the people, I would say. There is no patent. This is... Could you patent the sun?
So we know another way is possible. And in the beginning, we knew that the press was saying things like this: surely the vaccine will be free for everyone. Those were the questions we got when we first started talking publicly about the campaign and the work we were doing. But our thoughts were exactly this. We looked at decades of the fight for access to HIV medicines, and a lot of the people fighting today for COVID medicines are the very same activists who first started campaigning more than 20 years ago to ensure that people living with HIV would get access to life-saving medicines. And that's also how UAM, the organization that I lead, was founded in the fight for one particular HIV/AIDS medicine developed at Yale University with public funds, of course. And again, at the same time, we saw the challenge that the press was also writing about corporation ABC developing the vaccine, where in reality, if you look at the Moderna vaccine in particular, it's 100% funded by the public. All of the vaccines and all of the treatments have public funding in some capacity, including Pfizer's BioNTech vaccine as well. So when we launched, we had an initial round of volunteers from more than 29 different countries. And we started talking about the need for the vaccine to be free at the point of delivery, sustainably priced and available to all. We also launched several months before some of the larger agencies who we're now collaborating with through the People's Vaccine Alliance, such as the UNAIDS and Oxfam. And these are images from some of the early actions. And some of the young people who were leading the fight with us. We had members from about 17 years old to 72 years old, so a pretty diverse range from all over the world. Here are some of those folk and some of the images from different regions of the world as well. And right now, of course, it comes as no surprise to any of you that we know that a global apartheid has unfolded, but it hasn't unfolded accidentally. This is with intention. This is because of the greed of pharmaceutical corporations and because of the role that government has played not sharing the technology when they could have. Currently, the estimates are that 1 million lives already could have been saved if governments had protected global access rather than prioritizing profit. We just had the second anniversary of the WHO declaring that it was a global pandemic. and the People's Vaccine Alliance, which we're a founding member, has now organized groups, organizations all over the world to come together for continuing this fight. And you can learn more about the People's Vaccine at thepeoplesvaccine.org as well. So none of this is a surprise, but these are just snapshots from some of the news over the last number of months, and the inequity in terms of access that has been playing out, and the fact that countries like South Africa have been charged more for the vaccine than high-income countries. So obviously the last 2 years we've all been campaigning in a pandemic, which is an unusual way to organize, especially at a time of social distancing. So how have we done this, and how has it worked? So for us, we started with 300 activists. In our first cohort of 16 weeks, we've had 4 cohorts since. And we would meet online to discuss access to medicines and creative activism, and then work in these smaller groups, developing and deploying creative actions. And we built something called an Advocacy Innovation Lab to bring this work together, to collaboratively devise and design, implement, and evaluate as well new forms of advocacy that could succeed in these challenging times. You know, we weren't sure initially how we would be able to put pressure on those in power to give us the things that we needed and to raise our voices in a public way. So we had to have some COVID-safe in-person actions. These were some of the first. This was the Carnival March in the UK, that's outside UCL in London. And at the time, the restrictions only allowed up to 30 people to organize. So these were students in lab coats, besides some neon pink dancing protesters. And the call was for London University to take something that we were pushing for called the Open COVID Pledge, which universities still need to commit to share their intellectual property basically in an open way that would protect access, and to make their healthcare research on COVID-19 available to the world. So this is the march it was in July 2020 from King's College London to University College. And the other ask, of course, was to stop drug corporations from profiteering from publicly funded research. But one of the key things here is because of their bright costumes and their energy and fun and the music that was played, there was a lot of attention. They got covered in the BBC and the Telegraph. And it was an exciting moment for a lot of folks to be together, even if it was much smaller than would have been possible at other times. Meanwhile, in DC, this was a little later in the year, in Washington, outside Health and Human Services, there was the fight to make sure that the vaccine would be safe and effective, and it wouldn't be rushed through because of the upcoming US election that was going to happen a few weeks later. This was the Funk rally that we had. The video, again, because we wanted to make sure that there was social distancing and that people who couldn't come could watch from wherever they were. We had over 77,000 views online. And we also chose to center fun and dancing. And in this case, we had a lot of live bands who joined us on this bus as we rode through the city and marched and danced as a form of resistance but also as something that we knew that would attract people to want to come out and join us at the time. So here's a couple of images from that. And then one group who were involved were from Pittsburgh, and Pittsburgh has, the University of Pittsburgh is where Jonas Salk discovered the polio vaccine. So there are a number of different Salk actions. The ghost of Salk appeared at Halloween around Pittsburgh to remind the university that they too should sign something called the Open COVID Pledge to do what their predecessor, who they like to highlight, probably would have been rolling in his grave had he known what was happening at universities and at institutions all around the world, not sharing access to a life-saving medicine developed with public funds on a university campus. We also had some digital actions, social media campaign. These were some of the Instagram stories, an incredible rendition of Dr. Seuss's book called "Oh, the Places You'll Go with a Free Vaccine." And we were working on getting children to record the words and making a video as well. And all of these different actions you can actually see in an exhibit, which is linked to our Free the Vaccine page. It's freethevaccine.org/exhibit. So please check that out, and you can explore all these different ideas that have developed over the course of the pandemic. We've also had a lot of more traditional looking protests as well, and demonstrations throughout the course of the last 2 years, with other allies and partners, of course, in conjunction with the People's Vaccine. We even got Bernie Sanders to talk about the People's Vaccine as well in our rally in March of 2021. And again, this idea of centering popular culture and joy and fun at this heavy time when we knew that people were concerned and already stressed about not just the uncertainty, but about the impact of COVID on their lives. We wanted to make this an opportunity for people to be excited to be together, even at a social distance. And we used this message, very simple, sharing is caring, from the Care Bears, as the message to Joe Biden. You know, children understand that. This is what we teach family members from a young age. And we felt that it was a much easier message than trying to break down patenting and intellectual property. Ultimately, by sharing the recipe to the vaccine, we would be saving lives. And it's a basic value in society to share. And it turns out that these images were popular and much enjoyed, and ended up on the front page of many different newspapers around the world. But we also did one other thing here. You can see the ice cream truck. We wanted this message to really be driven home, because the idea of sharing was that, much like the vaccines with ice cream, if you were going to share ice cream with friends in other countries, you wouldn't ship ice cream. You would simply share the recipe, and they would make it locally. And this is really the same simple message that we have for governments and pharmaceutical corporations. You know, we could share ice cream and pies, and this is what we should be doing with vaccines. And on that day, the 5th of May, 2021, incredibly, due to sustained pressure from our movement and others, the US agreed to support the TRIPS waiver, which would waive the protections of IP on COVID-19 vaccines throughout the pandemic. However, this was a huge celebration for us. At that moment, it felt like an incredibly important shift. These were some of the coverage. But of course, we know that despite that monumental moment, the negotiations have still not happened. The fight isn't won yet. And recently there was leaked text that has not been endorsed by South Africa or India between the US and Europe about this waiver, which is really just simply the lowest common denominator. And it's at the same time that high income countries feel that they need to be going back to normal while the rest of the world struggles and feels the burden of our decisions. But I do have to say, we do at the Free the Vaccine believe we need to keep utopia on the horizon. This is not, we can't continue to, we have to keep focusing on what we want. And I think that for Medicare for All is the same vision. But what is utopia and why do we mention it here? Well, the word utopia was actually invented 500 years ago by an English writer and statesman, Thomas More, and it was to describe a fictional faraway island in his book by the same name. And utopia then had a democratically elected government and priesthood where women could attain positions of power. There was public health and education, and utopians were guaranteed the freedom of speech and religion. Utopia also provided foreign aid to other countries targeted towards the poor. Living and labor were rationally planned for the good of all, and perhaps the most utopian of all, there were no lawyers. More himself was a lawyer. And at the root of utopia, the source from which everything grows is the shared wealth and community of property. So utopia is ultimately very utopic, but it's something I think we need to keep moving towards in our fight and not get stuck on the in-between. So utopia itself is not a place. Utopia is actually made up of these Greek words that you see there, ou and topos. Ou meaning not and topos meaning place. So utopia is literally no place. So over and over in his book and in all sorts of ways, More creates a vision of an ideal world and tells us that it is possible. So what good is no place? And for us, utopia is a way of inspiring, critiquing, and believing that another world is possible. And I think for all of us in these fights, whether it's for COVID-19 medicines or for Medicare for all, or universal healthcare, health equity and justice for all, we need to keep the fight. We need to keep utopia on the horizon. And it motivates us. I think this last point here is really, really key, and it gives us the direction in which we're going. And it does take creativity to imagine winning. And sometimes I think we get caught up on the details. And this is why we need creativity, because we need that vision of where we could go and should go. I believe, we have the power to really shift the system. This is an extraordinary time, and it calls for extraordinary measures. And while Free the Vaccine has been fighting for access to COVID-19 medicines, we clearly need universal healthcare, because people would be more likely to take a vaccine if this wasn't the first time that people came knocking on their doors to care about their health. And it is obviously it shouldn't be a right. It shouldn't be a privilege. It should be a right. And talking about this particular moment, this quote, I think is key, and I think this provides a background for this moment. This idea that all too many people find themselves living amid a great period of social change, which I believe is now, and we think about also the parallel racial justice movement with the murder of George Floyd in June of 2020, and how that has fed into the global response as well. But I do believe that it is a time for new attitudes and new responses that demand that we fight for justice. So for those people who think that the world hasn't changed, remind them that it has, and we have an opportunity in a moment to, I think, design and develop and fight for the world that we want. There are a lot of lessons from the last 2 years and the steps towards a vision for health, equity, and justice that I think we have learned. I'm just going to mention 5 really quickly here for your organizing as you fight for Medicare for all. The first, as you've seen in some of these images, even though we've been at this particularly heavy moment, we have tried to center fun and joy. We knew that this was a particularly lonely moment when people were feeling a lack of agency, feeling powerless, not sure what was going to happen, making sure that our meetings were a moment of fun, joy, release. Not to say that we weren't acknowledging the heaviness of the moment, but so many of us, especially in the activist space, get burned out because call after call, meeting after meeting is so heavy because of the urgency and because of the impact of what is happening, not just to friends and family, but in hospitals, countries, nations, and the globe. So that's, I think, a key lesson, right? And it keeps people coming back, right? If it's something that you think you want to go to and are going to have fun at, you're more likely to be able to sustain it over a long period of time. Make sure that your organizing is people-driven, diverse, emphasizing a mixture of skills and experiences. We had people who had never heard of research and development, had never heard of clinical trials, let alone what the fight for access to a life-saving medicine would look like. But we invited everybody, as we said, from 17 to 72 to play a role, because this is something that was impacting everyone, and everybody has a voice. And it also made for exciting, different discussions, ideas, tactics, and it helped to lead to deep ongoing engagement from our participants. Here's a couple of quotes from some of them. Thirdly, I think it's really important that, the structure is maintained. We actually had a lot of Spanish-speaking participants, so we had in some of the seasons translation, simultaneous translation, to make sure that that was something we could offer. And then we had multiple meeting times for different hemispheres of the globe. It would be the same meeting, but at 2 different times of the day. And we also tried to gamify some of the structures to encourage people to participate and have fun. And also we had clear missions, targets, and we made sure that it was as clear and organized as possible for people, so that it made it easy to collaborate, and there would be accountability as well, and reward. The 4th tip here is to be experimental, try things, don't be afraid to fail. Doing the same thing over and over and expecting the same outcome is a sign of madness. So we thought we would try and test new creative tactics and approaches, because while things may have worked at one particular moment and have great meaning and impact, the world has changed so much in the last 2 years, and we felt that this was critical to ensuring progress. And the 5th tip here for today is just centering collaboration. We had all these different people working together, and it's not to say that you need hundreds of people like we had to achieve goals and move things forward, raising visibility. We had a lot of smaller groups who just shared the same interests, focused on engaging around vaccine confidence, etc., as well in their local communities. So try different actions, iterate on them, and keep refining. So we had a lot of different core strategies, and the Free the Vaccine applies a lot of methods of creative advocacy that the Center for Artistic Activism has studied and developed for more than a decade. And these techniques are based on lessons from social and behavioral sciences, the history of art and activism, and the world of advertising. They make creative advocacy stronger and more sustainable. And really, it's something that I would encourage all of you, if you're organizing, to learn more about. Interestingly, these strategies are also a lot of the principles for what an alternative research and development system could look like. You can certainly learn more on the Free the Vaccine website. So in sum, I think our movement share many of the same goals in terms of ensuring access to life-saving medicines, the fight for single payer, for universal healthcare system, knowing that people are centered and not profit in the negotiations between universities and pharmaceutical corporations, hospitals, so on and so forth. All of this matters. And I think we need to continue to keep these multiple fights on the horizon, but we would love to connect with you and stay in touch and see how we can support your organizing, your fight, and vice versa. So you can reach me here at Merith at uam.org, or on social at UAM_meds for people. And it's been a pleasure and privilege to share some of this today. And hopefully next time it will be in person. And wishing you a healthy and safe week. And I look forward to hearing from you. Thanks again for giving me the opportunity to share some of our experiences today. And let's keep the fight going. Thank you so much.